so that we know.
Do you want me to go off camera and mute for you to start and me come on, or?
Nope, we're actually live now, so we can go ahead and start. So I think we're all set. Everyone's here with us, so we can go ahead and start chit-chatting. Thank you to everyone who's joining us today. This is in lieu of our typical in-person beginning of session events. We're obviously going to be doing this live for you all. So thank you for joining us. Today, I'm here with Ashley Crayolito and Kayla Millette to discuss what we can expect to be coming up at the State House. If y'all are unfamiliar with WREN, WREN is a South Carolina-based network with the mission to build a movement to advance the health, economic well-being, and rights of women, girls, and their families. And so we're going to be chatting probably for about 20-30 minutes, so make sure you stick with us about everything that you can expect to be happening at the State House. And then we'll be chatting about that with Ashley, and then we'll transition into talking with Kayla about ways that you can get involved. So just as a heads up, we will be monitoring the comment section. So if you have questions at any point during this live stream, please feel free to type them in the comments and we'll try and answer them. If we don't get to them during the actual live stream, we'll just go ahead and we'll answer them in the comments below. So feel free to ask away and we will try and make sure every question you have gets answered. I'm gonna go ahead and give Ashley the chance to introduce herself.
Thank you, Maya. My name is Ashley Crayolito. I use she, her pronouns, and I'm the Director of Policy and Government Relations for WREN. And I'm really excited. Happy session day. Woo! Oh, I'm not actually here.
Yes, Ashley is at home because, you know, COVID. We're going to try and keep everyone safe and distance. I forgot to introduce myself. My name is Maya Ward. I am WREN's Communications and Development Associate, and I use she, her pronouns. So to start, Ashley, can you go ahead and explain what a legislative session even is for anyone who may not know?
Sure. So today is the first day of a 2-year legislative session. So in South Carolina, we go 2 full years in one session cycle. A cycle is what they debate bills within, and then that once a bill goes through that, at the end, it's dead if it hasn't passed. So we're starting off fresh slate. Anything you might have seen last year, any policy coming forward has to restart. So starting today, and we will go January through May, then they will pause and take a break, and then come back next January and finish the cycle in May of 2022. So that is if all goes as planned and if there are no global pandemics interfering with their planned sessions. So they're in session Tuesdays through Thursdays with set times to go into subcommittee, full committee, and general session times.
Okay, so anything that happened last year, not happening anymore, or not, it all has to start.
Those bill numbers are wiped clean. So the bill number of a policy you're thinking of, it gets reintroduced, it gets a new number. The policy starts from the beginning again. So say something you were watching went through the House and it was in the Senate almost to the finish line. Well, at the start of a new session, it's back at that starting line with every other piece of legislation.
Okay. And so correct me if I'm wrong, but legislative session is actually starting right now as we speak.
I just got the notification. Yes, both the House and the Senate are going in at noon to start the session, and they take the first day to do most of their organizing. So organizing what committees you're going to be in. The Senate will even be picking seats. They'll be adopting their rules, truly just really getting themselves organized so that they can do work going forward.
Okay. So since they're meeting in person, can you talk a little bit about the COVID protocols that they have in place to keep everyone safe?
Sure. So the Senate has mandated that all members and staff must wear their mask in the Senate chamber and in their office building, which is known as Gresset. And they are enforcing that mask for the general public as well. So if you are to go to Gresset, there is temperature checks at the door. They will ask you to socially distance, and they will require that you wear a mask in that building. The House has also sent out guidance for House members and staff. There's a mixed bag of requirement versus encourage on the House side. So we're going to see if all the House members wear their masks. But staff has been told that they are allowed to work within their offices and be available via email and phone if a member or a member of the public does not wear a mask around them. So there are some safety measures in place. The State House is open to the public. So they have not said that it is closed where you have to have an appointment to get in, but they are encouraging folks, if you don't have necessary business, to not go up there, to please wear a mask, socially distance, and do most of your business virtually if possible. So even when we're having hearings, as you've seen, are already being scheduled, they're offering both in-person and virtual options with safety protocols for the in-person as well.
Okay, that's good to know that they're trying to keep everyone safe and do what they can in that regard. So now the session has begun, basically right now. What can we expect our legislators to be focusing on?
Well, so from the general noise that you're hearing on what the legislature is going to focus on, of course, they're going to discuss COVID-19. They're going to talk about the measures that need to be in place, the state budget, because they have to make sure that the state runs. Our taxpayer dollars are being funneled to the programs to which we pay for. And then they're also potentially going to be discussing some highly controversial pieces of legislation, which will take up a lot of time. So abortion measures, I've heard that they are going to discuss things like open carry and things related to redistricting and voting. So a lot of really big topics to cover. And we're hoping that we can break through some of that political noise to make sure that we get policies that truly uplift South Carolinians as well.
Okay. And if you follow her on social media, and if you're on her email list, and if you're not, make sure you go scwren.org to join. You've probably seen that there's something coming up on Tuesday or on Thursday of this week. So Ashley, can you hit really quickly on what S1 is and what it means and what we need from our network?
Sure. So even prior to the start, so the session just went in, we got notice that the abortion ban, S1, that would ban abortion before most people know that they're pregnant, will be heard in the Senate Medical Affairs Subcommittee. And it has 5 subcommittee members chaired by Senator Tom Davis. And then it has Corbin, Cash, Bright Matthews, and Kimpson. They will be hearing public testimony on the bill. And there were options for folks to submit written testimony, video testimony, sign up to be virtually giving testimony live day of, and also in-person live day of. So folks were able to speak out, but they did limit that you needed to sign up or send in your testimony by 9 a.m. this morning. So we put out a call to say at the start of session, the very first thing that the General Assembly is focusing on during a public health crisis is to take away healthcare from South Carolinians. So you will see us and our partners out on your video screens virtually, speaking out against the ban, outlining why our state does not need healthcare taken away. And we really hope that you stay engaged, you make those phone calls to those subcommittee members, you spread awareness to other folks, because after the election cycle we just had, our state house has become even more hostile to reproductive rights. And so though it's always been a difficult fight to maintain bodily autonomy and to get politicians out of our healthcare decisions, it's even more so this year, and we all need to coalesce together to make sure it doesn't happen.
Awesome. Thanks for hitting on that. And Kayla's going to hop on in a minute to talk about ways that everyone else can get involved. But I also want to talk about not just the big things that we can expect from the legislature, but what are some of WREN's priorities for our legislators to be focusing on as a way to recover from COVID?
Sure. So one of the key roles we play as an organization and as a network is to truly lift up what our community needs. So we have worked with legislators to introduce policies that would help alleviate some of the effects of COVID and also build an infrastructure moving forward. So when the next crisis happens, we're more prepared. One of those policies is the Equal Pay Act. In South Carolina, Black women make 57.5 cents per every dollar a white man makes. That large disparity is something that is limiting to our communities and thus not able to save, not able to pay all of your bills. And when there's times of crises, say you got a medical bill because you needed to go into the hospital due to COVID, you weren't able to pay that and now you're in debt, or you lost your job. And unfortunately, unemployment isn't covering all of your bills. If you were paid appropriately, you could have potentially saved. So we must pay people based on their skill, effort, and responsibility. And we must have clear standards of transparency for how pay is set to eliminate discrimination. And it has been shown, studies have proven that policies, AKA legislation that's in place, helps alleviate the wage gap. So this is a necessary policy because we can't just rely on good faith efforts from folks to handle these things. Discrimination is still happening. We must take a stand on it now so that we can build better for the future. Another policy that we're working on is a continuation of something we started last session, but unfortunately, like I described before, died because the session ended. It is a 12 weeks of paid parental leave for state employees. So if you've been following along with WREN, we've been pushing for paid leave for all throughout this crisis. Is something that is just crucial for the economic recovery of our nation, and we need to catch up with other nations in the world. But this policy, it has bipartisan support. There's House and Senate bills, and is supported by the governor's office, provides 12 weeks paid parental leave to any state employee for the birth or adoption of a child. So we're really excited about the support that we have, and that our state has recognized that being able to take care of your family and get paid is crucial to uplifting our entire community. So we're really looking forward to that moving forward, and I'm hoping that we can get that going as fast as possible. And we're also supporting paid sick days bill, which would ensure that all people in the state of South Carolina, employed people, can earn sick days. So you might know that the federal emergency leave, which unfortunately was just not renewed in a way that it should have been, actually reduced COVID cases by 400 cases a day when people had access to that paid sick days. If you are able to take the time you need to take care of yourself or a family member when you are sick, you're actually able to stop the spread of illness. It's an amazing concept, very much proven. And so now our state needs to act upon sound policy as a core component to COVID recovery. So we're supporting that, as well as other bills that would uplift reproductive health, including reintroduction of the 12-month supply contraception, and supporting the Dignity in Pregnancy and Childbirth Act.
Okay, awesome. Ashley, is there anything else you want to touch on before I bring on Kayla to talk about ways that our network members can get involved? Or
let's bring on Kayla, and then we'll get to the comment section.
Awesome. Kayla, you want to hop on and join us, and you want to give yourself a brief introduction?
Hi, yes, thank you, Maya. I felt like Ashley gave me like that game show, like, let's bring on Kayla. That was great. That's only right for the beginning of session, right?
Confetti.
Yes. So my name is Kayla Millette, and I am the Network Engagement Manager at WREN. A large part of my job is just finding ways to make sure that we are bringing folks to the table that represent the broad array of people in our state who believe in our mission at WREN, so that we continue to build a movement that fights for things like just what we're talking about today: pay equity, paid leave for all, that we're bringing voices to the table around issues like the 6-week abortion ban, and to find ways that do that honor people's time and their interest, and also just, again, represents the broad array of folks in our state. And so I guess that's who I am.
Well, thank you. So I have just a quick question for you. So a lot of what WREN works towards, obviously, is making sure everyone who wants to has the chance to get involved in this legislative cycle, basically in all of the legislative cycles, and can really take at least some piece of advocacy action. So can you speak to us about a few of the ways that our members can actually get involved in a concrete way this year?
Yes, absolutely. So the first thing I would say, Maya, is that folks, if they have not, should download the South Carolina Legislature app, right? And you can get that from Play or the App Store or whatever. There's a statistic that 80% of people don't know who their state legislators are. And so I think part of the first step in like accountability is one, identifying who your legislators are, and then using tools like the legislative app to track progress of bills, to see what individual legislators are doing, to monitor what committees are doing, and then also to supplement that, or to also use the updates from WREN, from the newsletter that goes out, or updates on our blog, to help keep you informed on that as well. So the first thing I would say is to download the app if you have not. It only takes a second. The other thing is, I would say connect with your legislator and let them know what your priorities are. And, you know, hopefully those priorities include paid leave and pay equity. Ashley just gave a bunch of information about both. But again, WREN's blog and website, we also have information in language. If you want to talk to someone on staff, we'd be happy to help you talk a little more and understand those issues. But connect with your legislators and let them know what's important to you. And then the final thing is, I'd say stay up to date with what's happening with WREN, right? So follow us on social media. Our handle at Instagram and Twitter is WREN Network, WREN ETWORK, so 1 N. Keep up with us. Also share our content. So help us invite more folks into the network. You know, we typically consider folks who are in our network as anyone who takes action, who signs up for our listserv to get emails, who attends events. So help us to bring more folks into the fold, because, you know, like I mentioned, we want our work and our efforts to be representative of the broad array of voices that are in our state.
Awesome. Thank you, Kayla. In a second, we'll give you a couple of concrete links that you can actually click on to do some advocacy already. But I want to bring Ashley back real quick, because we had a couple questions from in the comment section that I wanted to get pointed out. So one, someone asked about how is the legislature working to protect safety, RE threats of violent protests, and what security measures could we expect to be in place for that?
I have not gotten official guidance out of the State House, the Sergeant at Arms, or any of the legislative leadership on what their explicit plans are to not only keep the legislators safe, but also members of the public who may want to enter in that space and advocate for what they need. I have heard that they're in discussion about what those needs are, and they are very aware of the threats. But until we see some of the protocol in place, I am not aware of what they have, and they might not tell us, members of the public, all of the key pieces that are in there as part of the safety protocol. But members are asking leadership for explicit guidance. They are aware of the threat. And we as WREN, as people who go up to the State House, as people who want to make sure anybody who goes up there, if we know something, we will be sure to explicitly share it with our community so that you can all be safe if you're going up there.
Perfect. And then we also had a question. As to vaccinations, and wondering if our members of Congress or members of the state legislature and their staff have had access to that vaccination. I think that's more of a safety question in that regard.
It is not explicitly open to legislators within the context of the rollout. So if any of the legislators had gotten the vaccine, they might have been a part of a different category that has priority for receiving the vaccination. And I do know that DHEC has opened it up for people to start signing up tomorrow if you're age 70 and up. And we do have some legislators who are in that age category. So I wonder if they will be doing it. If you are curious about your legislator, you could follow them. A lot of them have newsletters, but they also have social media accounts, and we can publish a list of where to access their accounts for you. And you could follow along. A lot of them have been posting when they, like, if they were going to take the vaccine, a lot of vaccination and testing information and they might even post their selfies with it. But there's not been explicit access for the vaccination for South Carolina legislators that I have seen.
Okay. And we had someone share in the comments that it was reported this morning in the paper that South Carolina senators should get access today, which is interesting news to me. If that's true, that's awesome. would definitely make me feel safer going to the State House if I knew that that was happening. And then the only other thing we had was someone asking if we could share a little bit of information on what the Family Leave and the Lactation Support Act actually mean. And just as we know, the Lactation Support Act passed in 2020 and is now law of the land. But if you want to give a quick rundown on that, and then a quick rundown on how the paid parental leave would work.
Yeah, I'm going to start with the know your rights information. So those folks who want to understand what rights you have in the workplace in relation to lactation and pregnancy accommodations is actually on the South Carolina Human Affairs website. It's clearly outlined of what rights you have and what employer obligations there are. Every person in the state of South Carolina who wants to express breast milk has the right to do so at work through break time. And they do that by discussing the accommodation that they need with their employer, and their employer, if it's a reasonable accommodation, must comply. We also have a pregnancy accommodations law that if you are suffering from a pregnancy related condition, including things that might happen after childbirth in the workplace, you will negotiate those with your employer. If it's a reasonable accommodation, you can have those. So that's on the South Carolina Human Affairs website. We also have a video with one of the lawyers from the South Carolina Human Affairs Commission from our summit this year that you can find on our website, where you can hear them specifically talking about the law and ways if you're experiencing discrimination within the workplace and need somebody to intervene. The South Carolina Human Affairs Commission is where you would do that report, and they would help guide you through that process. So hopefully you don't have to leave the workforce. You can negotiate with your employer to get that accommodation. So that's there. And then we also partner with a national organization known as A Better Balance, and they actually have a work law line that you can call, which is also on our website under the Lactation Support Act legislative win page. And you can call that and talk to a lawyer about all sorts of rights that you may have. Your right to sick time, your right to lactation, your right to family leave, and they help give you free guidance on how to move through that process. So I also want to uplift that for folks if they have questions. So that's the know your rights, the established things that you have under law right now. The parental leave law that we talked about before is currently just for state employees. It is a bill that must become law, and it would provide 12 weeks of paid leave for state employees, regardless of gender. So both male, female, or gender non-binary folks get the same amount of leave. And it is fully paid. So bipartisan support, and we're hoping that it passes. That is just parental. It does not include medical. You do have coverage for unpaid leave under the federal law that's known as FMLA. Most people know it as the FMLA, but it's the Family Medical Leave Act. And we are part of a large campaign for a lot of advocates across the country for paid leave for all. And you will see us advocating for federal legislation to try to ensure that every American has access to paid family medical leave. So also if you're active and want to be part of that conversation, just know we're still collecting stories related to paid leave. So if you have a story of where you've accessed it or needed to access it and were denied because we need the law in place, you can reach out to us and it'll be utilized in a way that respects you and that respects your story. And Kayla is amazing at doing that. And we will utilize that to leverage with Congress and with our state legislators to ensure that we get policies passed. So your story does matter. I have seen places where one story actually carried a full piece of legislation from start to finish because legislators connected with it. Yes.
That's awesome.
Yeah.
Awesome. Okay. So, and then time for one more question. And I'm going to pass this one to you, Kayla. Someone asked how they can learn more about just like the State House and how it works in general. And so I was thinking maybe you could chat about our Advocacy 101 trainings or anything like that.
Yeah, for sure. So WREN actually offers Advocacy 101 trainings for our network, members of our network and other organizations that are interested in learning more about how to engage members of the State House and how to become a part of the legislative process. This year, within the next 6 months, we will be offering a couple of Advocacy 101 trainings. So when we mentioned earlier to connect with us via social media or to follow the blog or to subscribe to the newsletter. That's a really great way to find out when those trainings are coming up. If you have more urgent and pressing questions, I'd also say reach out. I'm doing one-on-ones with members of the network just to share more about what WREN is and ways to get involved, including our advocacy team leader program, which would give folks opportunities to engage WREN, but also engage the legislative process and learn more from folks like Ashley. So, you know, be on the lookout for advocacy one-on-one trainings. And then if there's a larger group that's interested in having a training, I'd say reach out via email. You can email me. I think you can drop that in the chat box and we can work to schedule a training for your group.
Awesome. Okay, so we don't go too long on time. I'm going to go ahead and cut us off there. But thank y'all for joining today to talk about the legislative session that's coming up, or actually that just started. Just want to reiterate, WREN is a network, and we're trying to obviously gain members of our network so that we can be a strong collective voice in the South, across the Southeast, especially in South Carolina. And so if you aren't following us on Twitter, Instagram, it is at WREN Networks, all one word, WRENETWORK. If you aren't following us on Facebook, you're on our Facebook page watching this, so make sure you hit that follow button. And then we also have an email list where we send out some up-to-date information on what's going on. We keep you updated on policies as they happen, breaking news, everything like that. So make sure you go to scren.org to sign up for that email list. And then if you want, as I promised, to take action right now, there's lots of different ways to do it. You can access all these links on our Facebook or on our website, scren.org/take-action, or you can, we'll put the links in the comments below. But you can also text to advocate against the S1 abortion ban. You can text S.1, it's one word, to 52886. And then to advocate for the pay equity bill and the paid leave bill, you can text pay equity, one word, to 52886, or SC paid leave to 52886. And all of those actions take about maybe 2 minutes if you did all of them in a row. So it's a really easy, really fast way to do it, and it really does make a difference. So I'm going to say thank you again to Kayla and Ashley for joining me, and I'm going to sign off. If you still have questions, put them in the comments below. Even after the live has ended, we will try and make sure we go back and answer them. All right. Thanks for joining me, all.